Tungiasis, often referred to as jiggers, stands as a significant yet overlooked tropical skin affliction caused by the intrusion of the sand flea Tunga penetrans into the skin, particularly affecting the feet. This invasion results in excruciating itching, pain, and in severe cases, can lead to disability. Primarily impacting children of school age, the elderly, and individuals with disabilities, this ailment spans across Sub-Saharan Africa, Central and South America, its full scope obscured by an absence of comprehensive data. In Kenya alone, the government estimates a staggering 2 million people suffer from this condition, yet formal surveillance has never been conducted, leaving the true scale shrouded in uncertainty. Treatment within these communities remains a challenge, with the commonly used potassium permanganate causing skin irritation and exhibiting only mild effectiveness. However, glimmers of hope emerge from pioneering efforts. Promising results from a pilot clinical trial unveiled a concoction of neem and coconut oils, inducing premature aging in the fleas and significantly alleviating the agonizing pain experienced by affected children. Moreover, studies conducted elsewhere have demonstrated the efficacy of silicon-based oils in exterminating these fleas. It is apparent that combating Tungiasis necessitates a multifaceted strategy, merging treatment and prevention in a holistic One Health approach. Preventive measures hold paramount importance, encompassing the sealing of floors, daily foot hygiene practices involving soap, the utilization of insect repellents, and the maintenance of treated and segregated animal spaces. Yet, the implementation of these preventive measures presents challenges, particularly among the most impoverished families within communities, perpetuating the cycle of infection. In a groundbreaking initiative, Lynn Elson spearheads Kenya's inaugural National Prevalence Survey of Tungiasis. This comprehensive study aims not only to gauge the disease's prevalence but also to evaluate its pathological impact, scrutinize its toll on the quality of life, school attendance, and academic performance. Elson's research extends beyond statistics, delving into the ecology, social and psychological determinants of risk and outcomes, and probing the effects of improved flooring on diminishing Tungiasis prevalence. In addressing Tungiasis, a multifaceted approach combining innovative treatment methodologies and robust prevention strategies emerges as the beacon of hope in mitigating the suffering inflicted by this neglected tropical disease. Please remember to subscribe to our channel, click the like button, and activate the notification bell if you wish to see more content like this. Thanks for watching.